So good afternoon, everyone. My name is Dr. Lloyd Douglas, and I'm the public health physician for the Sioux First Nations Health Authority. And this afternoon, I'd like to give you a quick update as to the COVID situation in our area. Happy to report that we have zero cases. That's zero cases in the Sioux First Nations area at this time. And I just want to say thank you to everyone. You have been doing so safe, your families safe, and the communities safe. And that's excellent news. Also, we're happy to say that Operation Remote Immunity 2.0 is underway, and that's going very well in a number of First Nations communities. The uptake, has been good for the most part, and we're just happy that our young people are being, able to get their vaccines at this time. But we are not out of the woods just yet. I want to talk to you about a very serious situation that's happening next door to us in a community called Kashashiwan. At this time, they have a COVID-19 outbreak in their community, in that First Nation. Presently, today, when I just checked the case count, they are at 216 active cases. 216 active cases. I think that's coming down from 222 active cases. Now, when I look at that First Nation, a large amount of their adults got the vaccine during Operation Remote Immunity 1.0. Now, what happened was that the virus got into that community, one of the variants, I believe the UK variant, before they were able to vaccinate the young people in the community. And a large proportion of the cases are actually young people who didn't get the vaccine and also adults who did not get the vaccine. It's reported in the news that a number of individuals, I think the last time news from Saturday I saw, that a number of individuals, about 8 individuals, were airlifted from the community down south, because of COVID-19 to hospitals. I heard that one person is in the ICU. Now that's very concerning for for us here on this side. We have to remain vigilant, and we have to ensure that as many individuals in our communities get not just one, but two doses of the vaccine. At present, Operation Remote Immunity 2.0 is coming to the communities with the Pfizer vaccine for individuals aged 12 to 17. However, if you have not yet received a vaccine, Operation Remote Immunity, the Orange team is willing and they're able to give you your first dose of the Pfizer vaccine. Also, we're interchanging vaccines as well. We're mixing vaccines. So if your first dose was the Moderna vaccine and you didn't get the second dose and you want to get a second dose, you can go ahead and you can get the Pfizer vaccine at this time. I believe that if Kashashiwan First Nation was able to have vaccinated a larger proportion of their First Nation, then we would not have seen an outbreak to that magnitude. We're talking about a community of about 1,800 people, and to have over 200 individuals infected, that's staggering. Our heart goes out to the leadership of that community, to the people of that community, to all the healthcare providers and partners who are working very hard to contain this outbreak and bring it under control. And that is why it is very important for us in the Slifna era communities to ensure that our vaccine coverage rates are very, very, very high. So for those who are vaccine hesitant still, and I know that there are many reasons for why you may, not want to get the vaccine. Let me tell you, just look next door to us, and we can see what this virus can do. We now know that the Delta variant that's the variant that was first identified in India, is about 50 to 60% more transmissible. And we also see good information coming out of the United Kingdom that with two doses, you can have very good protection against hospitalization when against the Delta variant. So two doses, I think when I was looking at the information earlier today for the Pfizer vaccine, around two doses is somewhere between, I think, 92 to 95%, will protect you against the hospitalization from the Delta variant. And that's excellent news. So I'm just here to remind all of us it's very important that we get two doses of the vaccine. If you're 12 and older, the vaccine is approved for you. The vaccine will be made available for you, and I just ask kindly for you to go out there and get your vaccines. So until I see you the next time, I just want you to go get your vaccine. First and foremost, continue on with your public health measures. Be vigilant and know that the province has reopened a bit, but just look at what's happening next door to us in the Porcupine Health Unit region, along the Hudson Bay and the James Bay coast. A lot, over there in Timmins. Just look at what is happening over there. Look at those numbers. That is reminding us that we're not yet out of the woods and we should continue to remain vigilant. And you hear me repeating myself over and over again. Yes, I'm doing that intentionally because I really want you to consider getting the vaccine. So thank you so much. Until next time, walk good and God bless.